lot of women wonder if they can exercise, and the answer is definitely yes. Finally, let's go over some do's and don'ts during your pregnancy, but your OB will talk to you about this too. I'm just giving you some general information. So if your OB tells you something that is different than what I say, just do what your OB says, okay? Most OBs want to see you at first around 6 to 8 weeks. So if you haven't called your OB yet, like I told you, it's time to get on the phone and make an appointment. At your first appointment, your OB will want to ask you a bunch of questions about your past medical history, your surgeries, your medications, and also your family history. If you haven't had one in a while, they will probably collect a Pap test. You will also get lab work drawn, and these are called your prenatal labs. They are looking at your blood count, they look at your liver and kidney functions, your electrolytes, and they're checking for any STIs or sexually transmitted infections. And usually they'll check a urine test for an infection. So like I mentioned earlier, they're probably gonna go over things that you should and shouldn't do. So we're gonna talk about that right now. So first off, you wanna eat a well-balanced diet with lots of fruits and vegetables. Yes, you can and definitely should eat fish, or at least fish supplements, but avoid shark, swordfish, and tuna steak. So large fish that eat other fish. Don't eat unpasteurized dairy foods or raw foods or undercooked meats. If you have a cat, let somebody else change the kitty litter. Cat litter can have a parasite that causes something called toxoplasmosis. This is a rare infection that can hurt your baby. A lot of women wonder if they can exercise, and the answer is definitely yes. You can and should continue to exercise. You should avoid heavy weightlifting, but if you are already into heavy weightlifting, you need to talk to your OB about restrictions. Aerobic exercise is fine to do, but as a good rule, you want to make sure that you don't get so winded that you can't carry on a conversation comfortably. You can also travel both by car and by airplane all the way up to about 36 weeks. When you are traveling, be sure to get up and walk around every hour to keep the circulation moving through your legs to help avoid blood clots. If you do travel, avoid traveling to areas at risk for Zika virus. The Zika virus is known to cause birth defects. As far as sex goes, we've talked about this already, it's totally fine. Unless something is going on during your pregnancy where your OB specifies otherwise. They might ask you to abstain if you are having bleeding or preterm labor, for example.